Hello, this is Dr. Bob DeMaria. Welcome once again to the Half Off Health program. And tonight, I have two very special guests. And I actually live for these particular programs when I can have a young man that is courageous and decided to come in and join me here in the studio. We're going to be making an impact worldwide. You know, I've been a natural drugless doctor for over 30 years. And been so blessed. I've written several books, but one of the books that we're going to talk about tonight is we're going to talk about our ADHD book, and I'm going to share this with you. And this is exciting because I can see this happening with our guests. When somebody comes into my office and their child has been labeled, whatever that means, ADHD, I'm telling you what I'm seeing is they're very smart young people. We just have to put the right fuel in their body. I'm going to share this one frightening statistic with you. Are you ready? Right now, 1/4, listen to this, 1/4 of all the kids in the United States that are 20 years old or younger are on prescription medication. 25 million prescriptions for ADHD alone. So I'd like to introduce our guests, and we're going to talk about this. Was that amazing, Holly? 25 million.
It's unbelievable that so many people are on prescription drugs. Kids are on it.
Okay, so I have Holly and I have Billy. Billy, thank you for coming out of school today. That wasn't such a hard decision to make, was it? Okay, so let's start. How old was Billy when he had the official diagnosis that he was ADHD?
Officially, he was 6 when he was diagnosed, and he was also diagnosed with anxiety too.
And at that time, what grade would he have been in about?
It was just after kindergarten.
Could you imagine what was going on in your mind?
It was a battle with the teachers. The teacher did not want to deal with a kid who wasn't like the other kids. And so I knew long before the school had told me, but it didn't seem so out of control. I had no problems with the preschool teachers or anything. It just began in formal school.
So did he have disruptive behavior? What was it that?
He could not sit still. And the teacher couldn't adjust to just let him stand there.
You know, what's kind of interesting is we need to make a copy of this DVD and send it to his teacher that he had way back then, because look how calm that you are right now. So Billy, can you go back to that time period? How did you, is there anything that was going on in your mind at that time period? Can you go back to how you really thought back then?
Well, I didn't really think, I wasn't calm and stuff. Got tons of things on my mind, like what I would do when I got home, and I wouldn't pay attention in the classroom.
So you're really thinking about all the exciting stuff that you had to do at home, and here you are being bored at school.
Not really.
How does he do with the school grades?
His school grades always seemed pretty midline to upper, but it was always a struggle. I'd constantly have to help him. Simple problems would take hours to do for him.
So right now, and I just want to go ahead of myself, is it been easier at school as far as grades and studying?
It has definitely been easier for him.
Are you excited about that?
Yes.
Has it been easier in your own mind too? Are you able to think clear?
Yes.
That's good. So let's talk about this. How did you find out about what we do?
A neighbor of my mom's had told me about, she went to you for some chiropractic help and picked up a book. She thought her daughter might have ADHD and wanted to help her, and passed it along because we seemed to be having a little more difficulty. Read the book, and it took me a couple years to come. We followed the diet off and on, and knew there was some kind of food link, but took us a while to go full-fledged all the way to the complete diet.
So if you had this book, and I'm not saying this to be silly, if you had the book and there was an answer there, was there a reason that maybe you didn't pursue? Honestly.
I think it was skepticism of the people around us, what they thought. It's hard to do the diet. It definitely works now that we're full, but it's hard because when you go to a party, when you go to other people's house, there's no way they can have what we have. The people that we hang out, it's a lot of artificial stuff that they have, and it's more difficult. We have to pack coolers now, and so that's what took us a while to go. But
what's kind of interesting, because we pack coolers, and when we go places, which we could very easily stop at a fast food place and grab a burger and fries. But see, once you get into it, have you noticed it's become a little bit easier?
yes, yes.
That once you do that, so do you pack your lunch for school now?
Well, my mom still does, but I don't, because I don't know what to make, like, that's on my diet. Most of our stuff is, but
But every day he's got his lunch bag out in the car now.
Well, you know what's kind of interesting, because you don't think that food per se can make a difference until you start making some changes. So the people that are around you right now that have seen the change happening in Billy's life, what do they say?
They think it's terrific for us. They do try to accept and change when we're coming their way. And I've seen some changes, especially in his grandparents. We visit them a lot. They've made some changes and have more whole foods and whatnot, healthier, choices.
Did you think that when we were going through all this change, did you ever think that food would make that much of a difference, Billy?
no, I didn't.
I know that when he started coming into the office, we started him off, and a part of the program is taking some oils and avoiding certain foods that have trans fat in them, because that's a part of the issue that's going on here. And we started him taking flax capsules.
Right.
And
the capsules worked, but he needed some tweaking. He had hyper moments. And so I asked you when we came in for an adjustment, and you said that he should be on the oil. And we switched him over to the oil.
which was a liquid, by the way, just to clarify with everybody. So we had capsules that he was taking, because I learned something with Billy, which was good for me also. And then what happened when we flipped him from the capsules to the liquid?
He seemed to revert back to all his symptoms that he had before we started the diet.
It was almost like a blessing in disguise for you to see that, wouldn't you say? I mean,
Yeah.
It was not fun.
No, it was difficult, and we went back onto the capsules, which he's not taking a very high dose of capsules, but it keeps him very regulated. It's straight as far as his symptoms go.
So, since he's been taking these vitamins, et cetera, has he grown?
Yes.
Because I noticed when he came into that, I thought, wow, this young man has grown like 5 inches.
I had just made a comment when I was getting him ready today. I was almost eye level with him.
So how many months has it been?
It has been since May, so that's what?
Several months.
Several months.
Let me ask you this question. When he started the care, how long did it really take? Because the title of the book is Dr. Bob's Guide to Stop ADHD in 18 days.
Mm-hmm.
Now, I'm not trying to squeeze to say it was exactly 18 days, but he suffered for 7 years.
Yeah.
Were you surprised how quickly it all changed?
Yes. Yeah, it was a quick turnover, as long as he complied with the diet, which is hard because, like I said, a lot of the places you go, even the schools, pass out treats
I know,
that are
they don't get
horrible.
it, do they?
No.
Can you tell when you deviate? I mean, when you change your diet, can you see in your own mind?
Yes, I could feel very crazy when I eat the candy and stuff.
You can really feel it.
Yes, I can.
Tell me about your brain. I'm not saying this to be funny. Is your brain? Because one person described to me like there's static electricity that goes on in your brain. How did you describe what goes on in your brain?
Well, usually I get headaches the day after, or I just don't use my mind and stuff.
Since how do you like coming in for the adjustments?
It makes me feel a lot better when I come in.
Have you noticed that his overall health has been better?
Yeah.
So
yes.
like sinuses
Sinus
and breathing?
infections. He used to get sinus infections throughout the entire fall through spring.
So this has been one of the healthiest school years?
Yes, it has.
Are you excited about that?
Yes, I am.
Because you know what, and I know that, not to minimize this, but by you bringing him into our office and taking him off the medications, I just actually posted something on Facebook today about the number of kids who committed suicide because of drugs. We're talking that Billy could have been one of those statistics. And how many people are watching us somewhere in the world right now that they know that it could happen? Were you at your wit's end with him?
Yes. Yeah, we would battle off and on a great many days.
So there's less battles now? Are there any
Far
battles?
less.
Sometimes
He is 13.
Let me ask you this, Billy, because maybe I can help you. What is the biggest thing that you would like to have sometimes that probably will set you off? You can be honest.
Like some certain foods.
Yeah, what, any particular food?
Like fries that I eat at go to Giant Eagle on Sundays after church. I smell the fries and I want to eat fries.
So here's a suggestion, because fries, if I was to ever deviate, show me the fries, baby. But you know, we have rice oil in our office. So you could use those to make healthy fries. Because it heats up to 490 degrees. You could actually make, and see, here's what, let's just online here right now, let's take Billy to a whole nother level. He could help you peel the potatoes and put some gloves on them because we don't want any nicks on the hand, and you could start making your own French fries at home. Probably the biggest thing that we could help you and me with right now is let's teach him how to start helping you make his own lunch. Take him grocery shopping and purchasing certain items. It'll make a difference. There also are baked fries, you know, that you could bake in the oven. Have you ever tried those?
We bake most of our stuff if we can.
But if you wanted to, you could fry the French fries.
I'm sure those would taste
They would taste
better.
a lot better than baked. How about pain in your body? Did you used to have any pain, growing pains or pain?
Yes, I did. Through my legs. Sometimes my neck hurt.
And that's gone away?
Sometimes a little bit. Still hurts.
Are you sleeping better?
Yeah.
Okay, I don't want to bring your husband into the mix, but you know, anytime we have a mom and children, then we have dad over here. Because if mom changes the diet, you know, how has your husband been able to handle all of this?
He's pretty good. He just goes with the flow. He said if there's food in front of him, he'll eat it no matter what it is.
Did he ever have issues as a child with maybe ADHD?
Possibly. Quite possibly.
Well, because sometimes, you know, there is a little bit of familiar characteristics that can kind of go along. We don't want to label anybody. What kind of medication was Billy on?
Oh, he was on, I believe, all the stimulants that were out there to treat ADHD. His doctor switched him often. Every 3 months, Billy seemed to grow out of that prescription and have to start a new one.
Did you ever ask anybody else about diet?
I did.
And what did they say?
They would deny that diet had anything to do with his behavior.
Would you mind repeating that?
Behavior had nothing to do, they told me, with his diet. And I totally disagreed from that moment.
But you really didn't have any way to go?
No.
You didn't have
I had your book, and like I said, we followed that, but I tried to use that towards the doctors, and they were not having it. They were totally against
medication.
Yeah, they just wanted to use the medication.
Yeah, I'm sorry. Were you concerned about the side effects of these drugs? What did those drugs do to him?
The drugs, they had tremendous side effects. Going back to the depression, you talked about the suicide. Billy was very depressed when he was on the ADHD medication. He would actually close himself up in his room for hours and not want to come out. I mean, he would be what seemed super focused, but he was depressed, sad, angry a lot.
Those feelings are gone?
Yes.
Did you ever think about yourself? Like, you know, people do hang themselves?
No.
That's good. Thank you, Jesus, for that, huh?
Yeah.
So, this has been an awesome experience. I really just love having people come in and the family gets better. There are people watching us right now, and there's probably some young men just like you out there, maybe even a 6-year-old. What would you like to tell me to help them? Because, you know, Dr. Bob is always talking, and sometimes I think people think I make this up. So what would you like to say?
Well, Dr. Bob's diet plan and the stuff he gives me for my behavior, like the supplements, they really do help me. And Dr. Bob has helped me a lot.
That's good. You'd make a great chiropractor. Something to think about. Holly, touch me just briefly. What would you like to say to moms out there right now?
I would say to moms, question everything the doctor wants to give your child. Research it, and don't be afraid to necessarily go against what everybody is thinking. Billy has showed great improvement on not being on the ADHD drug since May 26th. We like to mark that day. I would give it a try. It definitely has showed great positive movements for him.
That's awesome. Billy, thank you so much for coming today. Holly, I appreciate your time and energy. Okay, well listen, pass this around the world, because 25 million prescriptions were giving out in the United States a year ago. 25 million antidepressants and psychotropic drugs. That means over almost 45 million prescriptions were given to kids just like Billy. This is serious. The world is ready for a revolution. We'll be right back. Hello, this is Dr. Bob and Debbie DeMaria. Welcome once again to our Half Hour of Health program. You know, Deb, I thoroughly do enjoy when somebody comes into the office and they're a young child and we're able to help eliminate and to help improve their overall function. I know that Billy was suffering for 7 years before he came into the office. And I know right now that there is somebody out there in the world that has major health problems and ADHD or ADD, and they're on medication, whatever the medication is. And I'm very serious. There are 25 million prescriptions last year, or within 2 years ago, that were directly related to, ADHD. And so this is a spine. And when somebody comes into the office, we take films of their spine. And when we did the pilot program on the individuals who had ADHD, their average neck curve was 10 degrees, and a normal neck curve should be 45 degrees. So one of the reasons that we have patients like Billy come into the office is we want to improve spinal function.
You're right, Dr. Bob. You know what? I want to comment on something that you ended the last segment and then give a challenge out to people. You ended on America's ready for a revolution. And you know what kind of revolution we're ready for? A drugless revolution. Without drugs, without medication, we can do a lot of things. Now, what's exciting is we have someone like Billy whose life was changed. Well, how many people do you know suffer with ADHD? It's not just children. It's not just a childhood disease or a childhood label. What about your friends? What about your sisters, brothers, children? Think about who else you can help, because Billy is a different person today who will affect other people's lives differently if he wasn't able to stay focused, if he wasn't able to communicate correctly. And think about the relationship that him and his mom now have in comparison to what they did have. Yes, she was really very good about being honest. He's 13, they still have some challenges, but it's not like what they used to have. Your life can change, and so can people around you. Consider what you can do.
What I want to share with you is a part of what happens today is partially hydrogenated oils. The partially hydrogenated oils that would be found in this commercial grade peanut butter. You need to become label savvy. If you see trans fat or partially hydrogenated oils on an item, that trans fat is going to interrupt normal fat metabolism in the brain. I'm holding in my hand right now some plastic French fries. The average American consumes 28 pounds of French fries. The problem is not the fries. The problem is the oils that the fries have been baked in or fried in. So that's one of the reasons I mentioned to Billy and his mom that we have rice oil that's actually on our website that's available to you that you could use that to fry things with. Now, we're not promoting frying food, but I would much rather have Billy at least periodically have French fries fried in rice oil that's not a trans fat. Here's the situation. A normal fat molecule is C-shape. C as in Charlie. Trans fat is T-shape. T as in Tom. The C's and the T's don't interact properly, causing confusion in the body. And when there's confusion in the body, the brain is not able to send the message down the spinal cord. So this printer cable is analogous to the spinal cord. The brain is sending 28 billion emails out every day. So in Dr. Bob's Guide to Stop ADHD in 18 days, now this is really significant that you understand this, the half-life of cis fat is 18 days. The half-life of trans fat is 51 days. That means if you had a pastry with hydrogenated fats, breakfast cereals with partially hydrogenated fats or trans fat, any item that you have with trans fat, regardless of what anybody says, regardless of what your conventional prescribing healthcare provider says, it alters physiology. Cis fat half-life 18 days. That's why we consistently will see improvement in a person in 2.5 weeks or 18 days. Now, Debbie said something at the beginning of this segment. There are more adults in America today that have ADHD than kids. See, ADHD kids, unless someone interrupts their lifestyle pattern, become ADHD adults. 25 million prescriptions. Wrap your brain around that, just for ADHD meds alone. 10 to 15 million additional, almost 25 million additional prescriptions on psychotropic drugs and antidepressants. Add the 15 and 25, and you have 40 million prescriptions on the average that are prescribed in America every year. And you wonder why the prescribing healthcare provider wouldn't say anything about diet and nutrition. They don't even believe that what you eat has an impact on neurologic health. And I'm going to tell you right now that kids commit suicide as some of the side effects, the bad effects of these drugs. And I know there's a child or two listening to me right now, or a parent or a grandparent that might be dealing with a child that has those suicidal thoughts. Then you need to get on a plane, you need to get into a car, and you need to come to our office. Go to our website, which is www.northcoastchiro.net. northcoastchiro.net. Watch some of the videos that we have on our Drugless Doctor website, druglessdoctor.com. This is very serious. Debbie talked about a revolution. We do need a drugless revolution in America today. There are too many people taking too many medications because it's easy for the healthcare provider just to write a prescription out to say, and go and take this. Did you hear what Holly said? Billy was on every medication. Billy was on every medication. He outgrew the medication. He was sitting here calmly in the chair. He's 13 years old. One of the areas that I have found in my experience that most children today that have ADHD tend to be males. And the reason, and a part of the reason is, males need more oils than females do. So if you have a young boy, especially today with all the massive approaches of all the different oils that are in all the different foods, if there's nothing else that you do, get them on a good quality source oil. Holly made a point. Now listen, because this is also very significant. Billy was having great success with flax capsules. He did not have the same success with flax oil. What occurred was the fact that Billy was not absorbing that flax oil deeply into his digestive system like he was with the flax capsules. So anybody can change. Now I also know that Holly, his mom, mentioned something about it being a little bit more challenging today because they pack a cooler. You know, I don't want to be contrary to what's going on in society today, but you have to do what you have to do because society wants everybody eating franchise in fast food. The average American child consumes nearly 170 meals outside of the home. 30 million kids eat at the National School Lunch Program every day. I'd like you to join me in my office. Go to our website. Join me in our office to become a new patient. We normally charge $165 to $200 for an exam and an x-ray. We'll do it for $25. Why? Because I'm passionate about making a difference in your life. You need to make that call today. Don't wait any longer. I promise you, you'll be glad you did.